Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss about calcium. So calcium is an abundant mineral that is seen in human beings, and the total average calcium in an adult is about 1000 grams, and 99% of this calcium we find in the bones and in teeth, and the rest of the calcium, the 1%, is seen in the various other tissues and body fluid. And the calcium which is present in the bones, mainly it is in the form of calcium phosphate. You will have to know that the total calcium, around 98 to 99%, whatever is there, that is present in the bone, and I've told you it is combined with the phosphate, and it is in the form of calcium phosphate hydroxyapatite. And the remaining 1%, what you see, is distributed. So 50% of which is ionized calcium, 10% is bound to anions like phosphates, bicarbonate, sulfates, etc. And 40% is bound to albumin. So that is protein bound. And this free calcium is the one which is very active. Metabolically active calcium is this free calcium. So I have told you 99% of the calcium is present in the bones, and 1% of the calcium is seen in the cell organelles, in the cytosol, and in the extracellular fluid. So this extracellular fluid will have protein bound calcium, the calcium which is bound to albumin. It has 5% which is bound to other substances like bicarbonates, citrates, lactates, phosphates, etc. This is the complexed calcium. And then the 55% of it, the extracellular calcium, is ionized calcium, the metabolically active calcium. So this is a important calcium. So when we measure the calcium in the serum, it is the total calcium. It is the calcium which is bound to anions, which is bound to your proteins. Everything is comes under the calcium, total serum calcium. But what is metabolically active is the free ionized calcium. And this is the one which is active as well as regulated by your PTH, vitamin D, etc. So I told you that the total calcium test, which is between 8.5 to 10.3 milligram per deciliter, that level of calcium, it is the total amount of calcium in your blood. It is both calcium attached to the proteins and the calcium which is free. So everything together is called as total calcium, and it is the most common test to be done. And ionized calcium measures only the amount of calcium that is not attached to proteins. That is the free calcium, ionized calcium, and that is usually between 4.6 to 5.3 milligram per deciliter. Then why not only do this ionized calcium? Why do this total calcium? Because estimation of ionized calcium is much difficult, much costlier compared to total calcium. So total calcium includes the total amount of calcium, the free as well as the bound form of calcium, and the normal range of which is around 8.5 to 10.3 milligram per deciliter. So this calcium absorption and balance depends upon various factors. So the usual calcium intake in the diet is around 500 to 1000 milligram per day, and this calcium usually we get from dietary sources which are rich in calcium like milk, like cheese, dairy products, etc. So the absorption and the excretion of the calcium is mainly maintained by your intestine, where the absorption occurs, the excretion from the kidneys, the feces, that is taken care of. The movement of the calcium in and out of the bones with the help of various hormones like your PTH, vitamin D, etc. So the metabolism of calcium can be divided into absorption. A few factors which affect the absorption of calcium, the mechanism of calcium absorption, the excretion of calcium, and the distribution and storage of calcium. So calcium absorption, I've told you that this happens in the small intestine. So this is through active transport which occurs in the duodenum and the jejunum, and the passive diffusion which occurs along the entire small intestine and is more likely at a higher calcium intake. When you take more of calcium, that time there is passive diffusion of this calcium and absorption of calcium in the intestine. So this intestine absorbs more than 90% of the calcium, when the colon absorbs the remaining 3 to 6%. The amount of calcium which is absorbed from the food is affected by various factors. You will see that this calcium absorption which is occurring in the intestine, and vitamin D3 helps in absorption of this calcium. So I've told you that there are certain factors which affect the absorption of the calcium. So which are the factors which help in the absorption of the calcium? Vitamin D, which helps in absorbing it. Parathyroid hormone, it increases the level of calcium, so it absorbs more and more of calcium. Acidic environment, the hydrochloric acid which is present in the stomach, it will help in the absorption of the calcium. The lactose in the milk, the amino acid like lysine, arginine, in exercise. So these are all the conditions which will help to increase the calcium level in the body. So whenever there is loss of stomach acidic pH, or there is less of an exercise, when there are loss of amino acids like lysine, arginine, etc., what happens? The absorption of calcium is impaired. When there is deficiency of vitamin D, there is absorption of calcium is impaired, and they can all lead to hypocalcemia. So there are certain factors which decrease the absorption of calcium. For example, oxalic acid and phytic acid in the food. Spinach will have this phytic acid. So if you consume spinach in excess, it will produce phytic acid, and that combines with the calcium, and the calcium may not be absorbed. Excess of phosphorus will have an inhibitory effect on the calcium. Stress, increased intake of caffeine or certain drugs like anticonvulsants, cortisone, thyroxine can decrease absorption of calcium. Lack of exercise and vitamin D deficiency can also cause decreased absorption of calcium. So the kidney also plays an important role in handling the calcium or in calcium homeostasis. When there are normal blood calcium levels, almost all of the calcium that enters this glomerulus is absorbed from the tubular system, and it is returned to the blood, and it preserves the calcium level. When the tubular reabsorption of calcium decreases, then the calcium is lost via excretion in the urine. So this you can see the different segments of the nephron, whereas 60 to 70% is absorbed in the PCT, proximal convoluted tubule, 20% in the loop of Henle, 10% in the DCT, and 5% in the collecting duct. So it will try to absorb as much as calcium and restore the blood levels of calcium. So the excretion of the calcium mainly happens through the stools. So the unabsorbed calcium in the diet, 60 to 70% is excreted in the stools. 50 to 200 milligrams per day of calcium is excreted in the urine, and around 15 milligram per day of calcium is excreted in the sweat. So calcium, I've told you, it is distributed both intracellularly as well as extracellularly. This calcium, it is associated with, attached with the mitochondria. It is seen in the nucleus. It is attached with the nuclear membrane. So this intracellular calcium, the calcium which remains inside the cell, it helps in the muscle contraction. It helps in the hormone secretion, in the glycogen metabolism, as well as the cell division. Whereas the extracellular calcium, that is the one which maintains the bone mineralization, the blood coagulation, the plasma membrane potential. So this is the function of the intracellular as well as extracellular calcium. So calcium is mainly regulated by three important hormones. The parathyroid gland, which secretes the PTH, the thyroid gland, which produces the calcitonin, and the kidney, which produces the 125 hydroxy D3. So they regulate the calcium. And which form of calcium they regulate? It's only the free calcium, the metabolically active calcium is the ones which are regulated by the these hormones. So whenever the body loses the calcium homeostasis, that is when the body tries to usually maintain to keep the serum level of calcium between 8.3 to 10.3 milligram per deciliter. Suppose if the calcium level decreases in the serum, the parathormone is the one which gets activated. So it will see that the osteoclast from the bones are activated, and they will remove more and more calcium from the bone and send it to the serum to increase the level of calcium in the serum. It will see that the calcium absorption from the kidney is increased, so that the level of calcium in the serum increases. It also increases the absorption of the calcium from the small intestine and decreases the excretion of the calcium from the kidneys. So by all this mechanism, it tries to increase the level of calcium in the blood. Suppose we get an increased level of calcium in the serum. If it is more than 10.3, what happens? It is the calcitonin which comes into play. So the thyroid gland will release the calcitonin. So once the thyroid glands are releasing the calcitonin, the osteoclast activity is inhibited. So the calcium reabsorption from the kidney is decreased. The calcium absorption from the intestine is decreased, and the calcium level in the blood will be decrease. This is a calcitonin which is released from the thyroid gland. So what does it do? It lowers the level of calcium in the blood. It inhibits the absorption of the calcium from the intestine, so that the level of calcium will not rise. It will promote the deposition of calcium in the bones. So what it will do? It will inhibit the osteoclast and it will stimulate the osteoblast. Whereas the PTH will increase the resorption of the bone. Whereas this calcitonin, it doesn't want more of calcium in the blood. So it will increase the osteoblastic activity and promotes the deposition of calcium. And calcitonin also inhibits the calcium reabsorption from the kidney. So calcitonin, what it will do? It will decrease the level of calcium in the blood. Whereas PTH, it will increase the level of calcium in the blood. It will stimulate the osteoclast so that more and more of calcium is resorbed from this bone. It will stimulate the kidneys to absorb more and more of calcium. It will stimulate the intestine to absorb more and more of vitamin D and raise the level of calcium in the serum. So these were few introductory factors about calcium. Calcium is an abundant mineral in our body. It plays a very important role. We will see the functions of the calcium in the next sessions. But remember, calcium is a very important element which maintains a lot of functions in the body. The distribution, the regulation, the factors which help us to absorb, the factors which help us to decrease the absorption of calcium all play a role in the homeostasis of calcium level in the body. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.